Hi everyone, I want to welcome you to Charter College. Welcome to the Medical Assisting Program. My name is Teresa Starr and I will be one of your instructors here during your time for your training. Together with Miss Yesenia and Miss Kiana, and we are all looking forward to your time here at Charter. I want to remind you to please show up every day on time. Bring a notebook and a pen, and please be sure to remember to bring your blood pressure cuff and stethoscope since we will be using them a lot in the lab. When you arrive to class, please make sure the very first thing you do is wash your hands. We have 2 sinks in this classroom. You will wash your hands for 20 seconds, no less. And basically the happy birthday song is about 20 seconds long, so you can sing it in your head and then you know that you've washed your hands for the appropriate amount of time. Welcome to your medical assisting lab, where you will be spending a lot of time learning and perfecting your skills, techniques, and procedures. We will be practicing a lot of the same things here that you will be doing when you go out into the field assisting your providers. So I'd like to go over first a few rules that we need to abide by while we're in the lab. And the number 1 rule, of course, there are many, but you always want to arrive to class with your Charter College scrubs. Make sure you're dressed appropriately, you have good hygiene. We have to pull our hair back when we are working in the lab. We want to make sure that hair is pulled back. And some of the basic rules that will apply when you actually go out into the offices to work. Things like not wearing acrylic nails, gel nails that are very long, harbors bacteria very easily underneath those gel nails, so please make sure you are not wearing them. Unfortunately, I do need to deduct points if you do show up to class with acrylic nails, so try not to wear those during your time here at Charter. Also, piercings should not be visible unless they are a stud earring. That is acceptable, and even a nose stud is acceptable, but no dangling earrings or any piercings anywhere else. The same rule applies for tattoos. If you do have tattoos, you please need to wear long sleeves to cover them up. Make sure that they are not visible. We also require that you wear your Charter College ID badge. You should have this by now. Usually you get this when you come to your first few classes here on campus. So hopefully you have your badge and you come to class wearing that also. I know that it can get kind of chilly sometimes, so we do ask that underneath your uniform you're wearing either a white or black long sleeve undershirt like this, no colors, no prints, no patterns. If you could just keep it to black or white, that would be acceptable. And as far as your uniform shoes, you are required to wear shoes that are puncture resistant. We do work with a lot of needles and sharps, so make sure you have a type of leather or faux leather surface on your shoes, not material, and definitely not canvas. Sometimes there are Converse that are worn. If the Converse do have that kind of faux leather top or tip, that is acceptable. The use of PPE. As we know, we're living amongst this pandemic right now, so we are going to be in full PPE when we are in the lab, which includes our gown, our mask, and our goggles, and of course gloves. This is the type of gown that you'll be given here to wear in the lab. I'll ask that you put your initials on it. They are very sparse right now. There's a back order, a shortage of these, as you can imagine, with the times we're living in. So we're gonna wear these until we can't wear them anymore. We'll definitely give you new ones, but we're gonna try to recycle these and use them as much as we can. So you'll be in a gown. You will also be wearing goggles for eye protection, and we have them throughout both labs, and a variety of glove sizes in both of our labs. So we have this lab that we work out of, and then next door there's a lab that mirrors this lab. So we want to remember to be professional at all times while we're in the lab. Yes, we can have fun while we're learning and performing these procedures, but we will be working with each other where we will be role playing, like one medical assistant student is the actual medical assistant and the other one will be playing the role of the patient. So we want to practice here how we will be interacting with a MA patient relationship, keeping everything professional, nice language, and also keeping privacy and confidentiality. You may see a urinalysis result, or maybe somebody's blood pressure is a little high one day. These are personal and private matters, so we don't want to leave the classroom and tell other classmates that this classmate had this or this classmate had that. So we keep everything very professional and private at all times. You want to wear a watch to class if you can with a second hand, and the second hand is going to help you because we will be timing a lot of our vital signs for 1 minute. So we do have a second hand on our clock here in the classroom, but it is nice to get in the habit of wearing a wristwatch so that you could just look down to time these procedures as you're doing them. We don't allow any food or drink in the labs. Food and drink, snacks will be saved for break time. If you are in a classroom and you have a drink, you have to make sure that it has a screw top and it should be water only. So also no gum chewing. No gum chewing is allowed anywhere on campus either. As far as cell phones, I understand life happens. I know emergencies can arise. I know a lot of you are parents and have families. If there is an emergency and you do need to take a call or answer a text, please just let me know before you leave the classroom and go ahead and take care of what you need to take care of outside of the classroom and then come back. We are going to be working with a lot of sharps and a lot of biohazardous material. Any bodily fluid is considered a biohazardous material. When we are working with sharps, they are to be disposed of in what is called a sharps container. We have these located around the classrooms, and you will dispose of your sharp in the top, bring down the little tab, and it will have it drop inside. You never want to put your fingers or hand inside. You never want to reach in and remove something and take it out. You just drop it in and then click this and it will drop inside. There's also a fill line that is shown here. So we never want the sharps line to get above the fill line. So if it goes right to this line, go ahead and let me know. This will actually close and seal, and then I will put it into the area that we have the company pick it up. Hazardous material companies, they incinerate these, they dispose of them at their plants, and these are never ever put in a trash can. So anything that is sharp in the office, whether it's a needle or a lancet that we use to puncture for finger sticks, a microscope glass cover or a glass slide, we will put all of this in the sharps container. There's also biohazard material that could be on your gauze or your cotton. There's a rule of thumb with this. While you're at school, we do have a rule that if there's blood on anything showing up, even on a Band-Aid, if you see a drop of blood, it's going to go in our red bag, as it's called. It's a biohazardous red bag receptacle. If you are doing a urinalysis, the urine dip is also a body fluid. That is not blood, and that is usually a clear or a lighter color, obviously, than blood. So that will also go in the red bag. It's body fluid, it's urine. There was a cup that the sample was given in, the little dipsticks that we use to look at the properties of the urine. Anything that has any contaminated body fluid on it will definitely go in the red bag. If there's no blood on it, you can go ahead and put it in a regular trash can, and these are located throughout the classroom as well. The red bags are also picked up by our hazmat type companies that will dispose of these materials. So remember, one drop of blood, it goes in the red bag, and then if it's a sharps, it goes in the sharps container. One thing I like to let you know is that this is your lab. I want you to open cupboards and get familiar with where things are kept. If you don't know what something is, please ask. Or if you don't know where something is kept, please ask me too. I usually have to check off some of the procedures, but if it's something like vital signs or something that you could do to practice on, please keep yourself busy with that. I don't want to really see you just sitting around. There's so much that you could be doing here in the lab. This is your lab, and please utilize it. I'd like to show you now where we keep our emergency eye wash station. So we will be working with bodily fluids here in the lab, and if there were to be an accident where some of that splashed in the eyes, this is the area that that student will come to immediately. And the way to turn this on is to notice these two green caps right here. So these caps are actually covering the area where the water will actually flow out to be able to be directed toward the eyes. So right now, this button is pushed in all the way. When the button is pushed in all the way, the water will only come out of the faucet like it's supposed to. So in order to get it to flow out of the eye wash station, you take the button and pull it straight out, and then you turn this on. And I'm going to just turn it on with a little bit of force, because the higher you go with the handle, it will actually shoot out this far, which makes sense because it needs to reach the eyes of the student. So make sure that the eyes are being flushed for 15 minutes. 15 minutes is the recommended time, and then when you are done with it, you have to remember to push this back in and put the caps on, and always try to remember to test it to make sure that it is functioning as a faucet again. So hopefully we're going to be really careful with our precautions when we are working with fluids that can splash, but accidents do happen, so we do have this protocol in place in case of an accident or a splash. Make sure, please, that you look around and make sure there's no trash on the floor, things are picked up and put back where they are supposed to be. Your countertops and your workstations definitely need to be sanitized with the Sani-Cloths that we have all throughout the classroom. So please make sure that you're cleaning the chairs, countertops, workstations, anywhere that you were working. And the exam tables, the table paper definitely has to be refreshed. It should be refreshed in between each student and definitely before we leave the classroom at the end of class.